to Two Peas in a Podcast, a series of conversations with people in our community about their journey through life. Grab a cup of tea and join us for our chat.
Episode 3, Be Not Afraid, a conversation about death and dying.
Welcome back to Two Peas in a Podcast. Simon, this is just episode number 3 for us, and tonight we're going to be speaking with Monica McNamara. How do you feel about the last episode?
Honestly, I can't believe it's only episode 3. This thing has a life of its own already, and the amount of really positive and powerful comments we've gotten back from episode 2, it's been amazing. Like, I think it has really touched a chord with people.
Yeah, I agree. And I think this conversation tonight is going to touch a chord as well. I know it will with me. I've known Monica and her husband Tim for probably a decade now. We first met in Nicaragua on a mission to build a house with Pathway to Progress Nicaragua, which is run by Ed and Barbara Dunsworth, who are from our parish here. Monica is a member of the parish leadership team. When I found out I was being assigned as pastor to Stella Maris Parish, I was delighted to know that I was going to be spending more time with Monica and Tim. So, Monica, what a pleasure to be here with you tonight. Thanks for agreeing to do this. And Simon, why don't you take it from here?
Absolutely. So our classic question, which we can say it's a classic question even though this is episode 3, is who is Monica?
Wow. Okay, I'm from very rural Nova Scotia. I am number 7 of 8 children in 9 years to my mom and dad. Grew up like living in the country, far from, half an hour from school. Not a lot of involvement there because my father worked all the time. My mother raised us all very well, could pickle or preserve or can anything that you can imagine, and looked after my dad's brother who lived next door as well. So besides feeding the 10 of us, she fed him as well. So it was like growing up in a little community within our house, as you can imagine. 1 bathroom, 10 people.
Yes, indeed.
It was a challenging time. So that was early. I came to Halifax to do my nursing degree and never left because nursing opportunities here were much more interesting than nursing opportunities in Guysborough. Met my husband in university. We settled here in Spryfield shortly after we were married and have never looked back. This has been our home, and raised our 3 boys in Spryfield. They grew up in this parish, and one of them lives in the community, which is really nice. I'm a new grandmother as of a year ago, and we are expecting another grandbaby in June. So there's lots going on with me.
So what inspired you to nursing?
Well, I think in those days, most of the opportunities open to girls graduating high school. We were either directed nursing or teaching. Teaching wasn't going to be my thing. So I don't know. I just always felt a call to be a nurse. The hospital school programs were on at that point in time as well. I graduated high school at 16 and could not get accepted into a hospital program because I was too young. So went to university.
You sound like an advanced student.
Yeah,
right?
I went to university and graduated with my degree when I was 20. And I definitely agree it was too young.
You graduated with a degree at 20.
Mm-hmm.
Wow.
Yeah.
Most people are still cracking beers at 20.
Well, not to say that didn't happen as well.
30, Simon.
Oh, yes.
Us Navy
30s
guys,
too.
come on.
True enough.
Yeah. So I worked at the VG hospital, the old VG, my entire career. My first 12 years were in general surgery. And then after about 12 years, I had an opportunity to move to palliative care, which I did very willingly and absolutely loved it. It was the best place I've ever worked. Worked there for 25 and still do a little bit of casual work there. I retired in April of 22, but did some casual work over the winter for my manager and may look at doing a little more next fall.
So in your early 30s, you got into palliative care.
I did.
You were a mom then. You probably had all 3 of your kids before you were 32.
I had all 3 of my kids before I was 30. That
Okay.
was my goal.
Yep.
Yeah.
How does a young mom and a nurse get into palliative care?
Yeah. Prior to palliative care, I worked general surgery, and it was I'm going to say thankless, but it was an impossible job. It was time when, I know we have a nursing shortage now, but at that time, we certainly didn't have enough nurses. It was how much work can you do and how little time. And nobody was allowed to say, it's time for this person to let go, to die. Nobody was allowed to die. So as a general surgeon, if one of your patients dies, that's a failure. And I spent too many nights resuscitating patients and dragging them to ICU when they should have been allowed to have a peaceful death.
Right. Wow.
And so, I can remember resuscitating 90 and 95-year-old patients in the middle of the night because their surgeon would not say they do not resuscitate. They wouldn't put a DNR order on their chart. They take them to the OR, open them up and do major surgery and then just hope for the best. Right. And nobody was having those discussions about, this isn't what I want. This isn't what we should be doing.
So in this materialistic world, how did it come to be in your mind that you didn't fear death in this way, or you saw death as a natural part of life? How did this all come to be?
I think just part of my faith, right? Death is as much a part of life as birth, right? And, we should be allowed to die when it's our time. And just that wasn't happening. Like, I just saw the treatment of a lot of the patients that they were put through things that they shouldn't have been. Chest compressions where you break somebody's ribs all the time, someone who's older and frail and really should not be put through that. But at that point, death wasn't a conversation that anyone was willing to have.
I was really fascinated about your comment there where you said in general surgery, almost people weren't allowed to die.
No.
And do you think that's because the surgeons didn't want to admit that they couldn't save this person? Or was it more of a direction from administration? Like, can you talk about where you feel that impetus came from? Because to your point, like these doctors would have seen death every day. It wouldn't have been a foreign concept to them, but obviously they wanted to avoid it as much as possible.
Yeah, I don't think it was a foreign concept so much as it looked like a failure. Right. I remember asking one surgeon one day, and I was a relatively new nurse, that we had this patient who wasn't doing well. And I had asked him, would he please put a DNR order on the patient's chart? Because I said, if this patient happens to this patient in the middle of the night, if he dies, I'm not going to be covered, for what I need to do. And he looks at me and he says, young lady, I don't care whether you are covered or not. He said, my patient is not going to die. And I just thought, oh my gosh, the patient is going to die. But not without a long drawn out process. And that's the part that really bothered me. Like I knew, not that I think all patients are going to die, but when somebody is like 90, 95 and they're frail and they're elderly and you just know that there's not going to be a good outcome, then why do you put people through that?
And do the surgeons have that conversation with them like prior to surgery? Like, are they upfront with them, or do you find it's the same case of you're not going to die, so we're not going to discuss it?
I think it's one of the side effects, or potential risks or complications that they have to talk about. I can't talk about what happens right now because I have not been a surgical nurse in a long time, since the 1990s. But I do see a bit of it with some of the other departments as well, sometimes with oncology physicians, with chemo doctors. It's hard for them to say to their patients, I don't have anything else to offer you. It's always, well, let's try one more thing. We've tried first line. Let's try second line chemo. When you get to the fourth line chemo, if they're giving you the best drugs in the first line and that didn't work, what does it tell you when they offer you the fourth line?
Yeah, like, is it a case of treating the person as a problem rather than a person, like a problem to be solved rather than a person to be journeyed with?
I don't know if it's that so much as being able to say, there's nothing else that I can do. And I think that's what people have a hard time expressing, saying to a patient who's coming to you because their life depends on the treatment that you can give them, being able to say, I don't have anything else to offer.
Yeah.
Monica, what is palliative care anyway?
Palliative care is pain and symptom management for patients with life-limiting illnesses and diseases. Lots of times palliative care will see patients while they're still being treated, still getting their chemo or getting their radiation just to help with symptom management. But lots of times we meet patients when there's no other treatment options for them. So we journey alongside of them, try to improve their quality of life, make them, help them to live as well as they can for whatever time they have left. Because nobody really knows how much time there is. Some patients live much better lives when they stop their treatments. Some people get really sick with their chemo. And when they stop, they're like, wow, I didn't realize that I could feel this good. Even though they know that their lifespan is limited, it's certainly a much better quality of life.
And palliative care patients can be home-based or hospital-based.
That's
and
right.
Hospice.
And hospice, yep. So we have an inpatient palliative care unit that has 10 beds. And that's usually reserved for patients within the last 2 to 3 weeks of their lives, just because there's more of a rapid turnover there. It's a little more acute. There is a freestanding hospice in the south end of Halifax that also has 10 beds, and that is more geared to patients, say, in the 3 to 6 month span of their illness, who have decided that there's no more treatment. They don't want any more treatment. They don't want investigation. They want to simply live the rest of their life in comfort with good symptom management and with their families as involved as they can be. And then we also have a team of 12 palliative care community nurses that cover all of HRM. As well as a couple, one in Windsor and one in Middle Musquodoboit, who manage patients in their own homes. And they follow anywhere up from probably about 20 to 25 patients per nurse. So that's potentially 250 patients that are being cared for either in-home or being seen in their clinics. Yeah. So it depends on what the patient wants, what the family wants. I think lots of people say, oh, I'd love to die at home. And I personally would love to die at home, but it's not always possible. Mm-hmm. It's not always manageable for the families. Given the size of families today, small numbers, sometimes they just can't manage care, even with home care VON. Sometimes the services just aren't adequate and patients need to either go to hospital or go to hospice. Sometimes symptoms are too difficult to manage at home because they need more of the hands-on, 24/7 to make adjustments to medications and things. But someone whose course of illness is relatively, fairly steady, they're fairly stable in their decline and not a huge symptom burden, then lots of those patients can be at home.
So with medicine being what it is today, and I don't have a medical bone in my body, so I apologize if I can't even ask this question properly. But with medicine being where it is today, for the typical person who begins palliative care at home, symptoms are being managed well, there's a reasonable quality of life, and they're in a familiar environment, then they move into the ward, become an inpatient. Is it reasonable to expect that most physical pain and suffering can be alleviated by modern medicine?
Sometimes people don't have pain, and some people have lots of pain, but there is really no limit to the amount of medication that we can use. I know people hear the words morphine or Dilaudid and they get very, very anxious, but really medicines are so good today that there's really not a lot of pain that we can't manage. Sometimes there's intractable pain and it's very difficult, but the medicines that we have are very, very good. And I see a lot of patients that die very, very comfortably. I'd say I've seen more patients die comfortably than I've seen patients die in pain.
Now, you mentioned, that they're dying comfortably. Would you say they're also dying at peace?
It depends on how accepting they are. I think people of faith, I've certainly seen die at peace more than people without faith. Younger people have more of a problem accepting the reality of their death. People that have had a long life, have no regrets, feel like they have lived well, tend to die more at peace. People that have a belief system, people that know where they're going. I once had a patient of a different religion, and he was dying. He was a physician, and he had said to me, he said, I had a friend that died not that long ago, and I really envy him. And I said, why is that? He said, because he was Catholic, and he knew that when he died, he was going to a better place. He's like, I don't have that, and I don't, he said, I just think I'm going to die. It's the end.
How often do people worry that they're not going to a better place? Of those that have a belief system, are they saying, I'm not destined for where I should be?
I haven't really heard somebody say that. I have had a few patients that would say to me, I used to be a Catholic, but I haven't gone in a long time, haven't been to church in a long time, and I can't think of any priest who'd want to talk to me now. And that was the point in time where Father Owen Conley was our hospital chaplain. And I said, you know what? I know a priest who would love to talk to you right now. And without fail, Father Owen always would show up and talk to him. But I haven't really had anybody say, oh, I don't know if I'm going up or down. Is that sort of what you're meaning?
Yeah, exactly.
Yeah. No. But this physician, though, was so distressed about his impending death that he went on a weekend pass and committed suicide. He could not wait.
Just the not knowing.
Just the not knowing, and not knowing how it was going to end or when it was going to end. He had brought it about himself. So.
Do you find that loss of control is a big issue for people?
Absolutely.
Like, is that one of the, apart from, Rob, you mentioned about pain and worrying about being in pain, but is it that loss of control and not knowing what's going to happen and when and what happens afterwards? Like, all of those questions are really troubling people?
I don't think it's so much the what's going to happen afterwards. It's how am I going to get there? Like, I'm not worried about dying. Most people say I'm worried about how I'm going to get there.
The process of
dying, how I'm going to get there. People don't want to lose control, and they don't want to be a burden, right? Those are their two biggest worries, right? When I can't do this for myself, then I don't want to live anymore. And sometimes it's as simple as when I can't feed myself, or when I can't take myself to the bathroom, when I can't get myself out of bed, then life's not worth living anymore. But you don't really know that until you get there, right? There's lots of people who don't get out of bed who still have a very good quality of life, or a lot of people who don't have the use of their hands to feed themselves, but still can enjoy things about life.
I'm sure you know the Reverend David McGinley.
I do.
I love that guy, and I've spoken to him several times. David was a chaplain on the palliative care ward. And he speaks of this beautiful process of dying where we learn to surrender along the way. And so thereby we learn to participate in a peace that surpasses all understanding as a process of dying. So it's almost every little step is a little wee foretaste of the goodness that's ahead, because we have learned to release little bits along the way, till the point where we get to the final release, which is, I release it all. And this, of course, requires, I would say, a healthy understanding of God, who is there to embrace us.
And so, like the palliative nurses that you've worked with over your long career, would you say there's any kind of, I'll call them common themes which are maybe more prevalent in them than you would see, let's say, in a general OR nurse or in any other kind of nursing? Do you find there's a different qualities required for palliative care?
Absolutely. It's hard to articulate it though, but palliative care attracts a certain type of person. You've got to be somebody who's comfortable with death, who's comfortable talking about death, and even someone you're meeting for the first time. Right? It's difficult to jump into that conversation. Hey, I'm just meeting you. How do you feel about your dying? Knowing that you're dying, and how do you feel? Like sometimes that's difficult to get there. Right? So
part of what I love about being a priest is going deep.
Yeah.
Let's
and you have
let's get to the meat.
You've only got this much time to get this. Let's get this conversation going. And I think that's something that we I'm not going to say perfect because none of us are perfect, but something that we improve as our careers go on. But it's certainly, you can see the difference. I can see the difference between a palliative care nurse and a general nurse. Like there's no general nurses anymore. Every nurse is very specific to what they do, but I think there's something within the person that draws them to that part of the profession. Because I've seen lots of nurses come and go thinking, oh, this is going to be it for me. And they're like, no, I can't do this. This isn't my thing. So, yeah.
Monica, here in Canada, we call it medical assistance in dying, physician-assisted suicide. How has this changed your working environment on a palliative care ward?
Well, it's certainly an option that's offered to everyone. As a nurse, we're not permitted to bring up medical assistance in dying when talking with a patient. But if a patient asks about it, then we are to pass that information on to a physician to talk to them. But it's certainly out there. It's an option, and it's incredible. Our palliative care team is not a provider of medical assistance in dying, although some of the physicians will do the first assessment. And sometimes, we're obligated to care for the patients that are requesting it. We're not obligated to be a part of the procedure, but there are nurses and physicians on the team that support medical assistance in dying.
So as a registered nurse in Nova Scotia, you have the right of conscience to be able to say, I won't be part of that.
Yes, I have made that very clear with my previous manager and my manager. I just went back to work for Casualty. I had given him 3 stipulations when I left. When I started, I would work on certain days. And there was something else, I can't remember the other one. And I said, the third one I said is, and I will have nothing to do with any MAID procedures. So, and he was okay with that.
Yeah. But yet you are happy, of course, to journey with people who have made that decision. They're not going to get inferior care.
No.
Because they have made that decision.
No. And we care for them up until the moment that that procedure happens.
Yeah.
Because they deserve, good palliative care just like anyone else. Yeah.
Isn't it interesting how in your early years as a nurse, albeit a surgical nurse, you were dealing with an insistence of keeping the patient alive, and as seen through the lens of perhaps professional failure, I don't want them to die.
Yeah.
And now we have a very different reality, although it's not a surgical scenario. I know we're talking about a little bit of apples and oranges here, but the prevalence in the medical profession to hasten, I should say, not assist. Assist is not the right word, but to hasten the dying process.
I know it's frequently brought up in conversations between doctors and patients, and sometimes it isn't the patient that brings it up first. It's brought up by a physician as, have you considered this option?
I was privy to dealing with someone, I'll keep the details all very, very general, but she called a couple of friends from the parish when she was not feeling well. And so this couple went over to see her, and they said, although they are not medical experts, they said, they validated the very fact as to why she called them, which was to say, I'm not feeling well. When they arrived, they thought, you should really call 911, which this person did. And one of the questions the paramedics asked when they arrived was, have you considered medical assistance in dying? I wouldn't have believed that, but it was witnessed by two people who were there. And then when she was brought down to the emerge and triaged, this patient was again asked by the emerge room physician, have you considered medical assistance in dying? So it's becoming a little more normative, I think, than most of us know. And I read a piece on CBC News just in the past week or so of a 27-year-old autistic woman who lived with her parents, I believe, certainly her father, because it was her father who tried to legally block her acceptance into death by physician-assisted death. He lost in court, and so as a 27-year-old autistic woman, the court backed up her right to make this decision to elect for MAID. It's a very, very interesting conversation that's taking place in our country these days. It's profoundly unnerving. Monica, as a nurse in this day and age, in the field that you work in, and as a Catholic woman, how did you come to terms with your decision not to participate in MAID? There must have been a personal wrestling with, do I participate in MAID or not?
I think it's part of my faith. Like, God decides when we're born and God decides when we die.
So it's really the simple truth of there are some things that are beyond our control.
Absolutely.
When we're born and to whom we're born is not our decision.
Is not our decision.
And when we die is not our decision.
Yeah. How does somebody taking their own life differ any from a physician taking someone's life? You know, it's not your time. It's not your time, right?
Mm-hmm.
God knows when your time is, and He's going to tell you, and He's going to come and get you. But I don't know. It's just not right. It's just, I can't do it. Yeah.
And I guess it could also be that people are seeing this as an option because they don't feel that God is with them, perhaps during their suffering, and they just want to be released from it. And they're not perhaps realizing that throughout the experience they're having, which is making them consider MAID, that God is with them.
Simon, I think just in the conversations that I've had in the past few years, I think it is far less a God-based conversation and more around the practical matters of not wanting to be a burden to their loved ones and not wanting to suffer.
I agree.
But I guess the burden part may be exacerbated or perhaps emphasized by the fact that they feel that they're not being assisted in that burden. You know, that they don't want to be a burden to their family, to their loved ones, to the nurses, the doctors. Our emphasis on being self-reliant, which is, really prevalent in our modern age, makes us all want to not be a burden to anybody. And so I was wondering, when you were talking about growing up in your big family, looking with your mother, also looking after her brother that was next
brother-in-law,
brother-in-law that was next door, like big families and communities are built on people being burdens and carrying other people's burdens.
Mm-hmm.
And so I was wondering if you could talk a bit about how the experience of a small community and a big family in a small community has shaped your impression of people as, as burdens that should be carried.
One of my earliest memories was, I think I was probably in school, so maybe 5 or 6. I remember one of our neighbors was going to the hospital to have a baby, and it was either her 5th or her 6th baby. So my mom at this point, if I was 5 or 6, my oldest sibling would have been 13, 14, and 8 of us, took in 2 of her neighbors' children while this lady went to the hospital to have her baby. So now there's 12 of us in a 10-person house, right? Like communities did that. Communities looked after each other. I know when my mom went to the hospital to have myself and probably my younger sister, one of the local teenage girls from the community came and stayed with my dad and helped him to look after all the children. It's just something that small communities do. Right now, as you know, my 94-year-old mom, soon to be 94-year-old mom, still lives in her own home. My sisters and I each take a week a month and go back to her home to care for her because she doesn't want to live anywhere else.
But
right?
At no point do you guys see her as a burden.
Never.
Like,
No.
That's the thing.
Yeah.
Your life experiences, I think it's fair to say, have really emphasized the fact that, your family cannot be a burden. Like, your family is part of who you are. Yeah. And it is both your duty and your privilege to support your family.
Well said.
I don't know if you watched Dr. Dean. I didn't get an opportunity to go to Dr. David Dean's. He did a mission down at the Basilica, but I watched it online. And his overall theme through all 3 nights was, be a burden. He said, it's your duty. As a Christian, you're denying your family the right to care for you by ending your life. He's like, we all owe it to our families. Not meaning be a huge burden, but like that's what people say, I don't want to be a burden. And sometimes they're not a burden. My mother is not a burden, right? She's a joy. And we owe that gift to our families to allow them the opportunity to care for us.
Yeah, because when we devalue others, when we kind of add up the cost of caring for another person, then, we're almost adding weight to that burden by saying, here's all the things I'm giving up. Here's all the things I can't do anymore. Here's all of the expenses that I'm incurring now. But we're not focusing on, here's the time I'm spending with you. Mm-hmm. Here's the love I'm giving you. Here's the love you're giving me, right? Here's my opportunity to minister to you as you minister to me. Like we don't necessarily talk about that when we'll call it counting the cost of caring for somebody.
It may feel burdensome, but it is not an objective burden, right?
Well, yeah, and I mean,
it's a call to relationship. It's a call to love.
Absolutely. And Monica, I'm sure you can speak to this about how, families as they journey with somebody through the palliative care process, they get tired. Mm-hmm. They get tired of this process. They get tired of coming and sitting by the bedside saying, I hate to say this, but, are you dead yet? Yeah. Right? Like they get tired of that waiting, and that they're just the physical and mental exhaustion of the stress of the dying process and being in palliative care. Like people don't want to put their families through that, but it's this moment of loving and receiving love that people, I think, perhaps are missing out on.
We are missing out on it. We are missing out on the psycho-spiritual beauty of caring for our loved ones who are not a burden.
That's right.
It may be burdensome, but they are not a burden.
Not a burden. And it's more difficult today. Like families are smaller. Most families don't have 8 children they can call on to, provide care. If there's 1 or 2 and families are so spread so far and wide that it is definitely more difficult to do. But if by having the opportunity to do it, you're right. It's very fulfilling.
I'm reminded of an experience I had. I was called into a long-term care facility, as I regularly am, and all I knew, I was going in to see a 92-year-old woman who was near death. And when I entered the room, I was shocked to see this 92-year-old woman. I normally go in and the person looks like they're near death. This woman was radiant. She looked like a healthy 68-year-old. And she was cognitively brighter than I am, a storyteller. And she had elected to receive physician-assisted death. I don't know why she called a priest. She wasn't Catholic. What she asked, well, I guess I do know why. The question that was most on her mind is, I don't know how to do this. Like, I don't know how to go about this dying process. I found it difficult to communicate with her about the process of dying because the language of surrender and of letting go was foreign to her. The way she was articulating her decision was all through the lens of control, not of surrender and letting go and embracing the vulnerability of the human condition. These were all concepts that she had no understanding of whatsoever. They were irrelevant because she felt like she could control things, even the process of her dying. But there was another interesting thing of the room that I went into. Through the conversation, she explained to me that she wasn't in the room that she had been living in for years in this seniors facility. She was moved into another room that was as institutional as you could possibly get. There weren't even pictures on the wall. It was a gurney, just a sanitized room whose only purpose was death. There was nothing around. There was nothing familial. There was nothing comforting. And this dear woman, we had a beautiful conversation. She didn't want any of the sacraments the church has to offer. Not that I could anyway, but she didn't want any of them. She didn't even want prayer. The only discernible thing that she wanted was to talk to someone about the process of dying.
And what I find interesting about your story is that she didn't want to know how medically the process of dying works. She wanted to know how emotionally and spiritually the process
How do
works.
I do this? That's right. Like without being equipped with the spiritual language that we could journey together with.
And I guess, Monica, like in your experience as a palliative care nurse, do you find that indeed the medical system is really good at telling you how you're going to die and helping you through the physicality of dying, but is it good at dealing with your emotions as you die, your fears, your loss of control, and the big S or small s spirituality that people have, either a formal religion or just the concept of spirituality? Do you find that the medical profession really doesn't know how to do that part?
I would definitely agree with that. We've had some very good spiritual care providers. Dave McGinley has been excellent. Father Owen Conley. I know Father Ron is there now. And, and chaplains from all disciplines work very well with the patients, but only if the patients want it. There's so many people without faith that don't even want to go there, right? They want to die on their own terms when they say, like, in their own control.
Mm. Yeah. And it's almost like, the chaplains that you're talking about are being brought in as specialists. Like, I'm going to bring in the heart specialist. I'm going to bring in the kidney specialist. I'm going to bring in the spirit specialist.
Yeah. David McGinley did a presentation for our palliative care team one time, and it was specifically to talk about MAID. And he had said, I've seen the patients going through MAID, and he said, and they don't have time to process all that you need to process, all the steps of dying. Like you've talked about all the little stages of letting go. And he's like, there's just no time. When you have made a decision about made and you've set your date, then that's it. Like there's none of this working through what I've got to go through spiritually or emotionally to get there.
He's no longer working.
He's retired. I know.
Yeah.
That's a big loss.
It's a huge loss.
So when you think again back to your early nursing days, and from when you first left the university bright-eyed and bushy-tailed, and then to towards the end of your active working career, are there folks who you could say have really affected how you have conducted yourself as a nurse, not necessarily from a clinical standpoint, but as an emotional and empathetic standpoint?
I think our palliative care physicians do an excellent job of more than just the physical, right? Palliative care kind of looks at physical, social, emotional, mental, psychological, like all those things together. And a lot of times patients that are in pain, it's not just physical pain. It can be mental pain or emotional pain. And they do a really good job of addressing all of that. I haven't seen that a great deal in other disciplines, but I've certainly seen it done very well by my palliative care colleagues.
So it's more of they're really seeing the person more holistically, to use a buzzword, than perhaps other professions where it's like, again, I'm only concerned about your heart.
Yeah,
I'm
your
only
heart
concerned
or your
about
hip
kidney.
or your brain no, they certainly do look at the whole person.
Have there been any particular individuals that have stood out?
There's a few. There's a few physicians that I really admire and enjoy working with. And I have said to them, if I ever need to have this conversation, I want you to be the one having this conversation with me.
Mm-hmm.
So,
and I guess that's a really interesting segue, because having seen so many people die over the course of your career, what do you think your own death will be like?
well, if I have my say, it's going to be in my home and not in a hospital. I don't know. Nobody knows what our own deaths are going to look like. I constantly tell my children that when I'm too old to look after myself, I'm moving in with them. But that remains to be seen. Yeah, I get a few eye rolls on that one. Yeah. I don't know. I know what a good death would look like, would be, being able to be at home. Palliative care and palliative medicine have come so far over even the last 25 years since I started working there. Like there's been huge improvements. I'm not going to be afraid to accept medications if someone offers me, we just said we don't give medals to people who don't take their pain meds. There's no heroes here. There's no trophies for holding off when you can be more comfortable, but still functional.
Yeah. My mother's side of my family is full of Alzheimer's and dementia. And typically they get it in their late 60s, and many of them are dead in their early to mid 70s. Several of my mother's siblings have already died from it. Her father, all of his siblings have died of it. So when I think about the type of death that I will have, I will say here and will say anywhere, I hope it's not from Alzheimer's, because enjoy life. I like to think and articulate things that I love and care for, and to know my grandfather was such a gentle man, and when he first started going down this path that was later understood to be Alzheimer's, his personality changed so much, and the stuff that was coming out of his mouth, this is not. So there are many little deaths along the way. So it's not an ideal way to go, but all of these things are out of our hands. What I can tell you, and back to a point we made of burdensome or being a burden, my grandmother and her children, and indeed all of it, and the community, he died well, because he was surrounded by loving care, in the same home that he fostered loving care as a father and a grandfather. So it was a good death.
Do you find, Monica, there's been a lot of changes that you've observed in how the families deal with somebody dying?
Definitely. I think young people today have very little to no experience with death, so that when a death comes in their family, they don't know what to do. There's so many young people that have never set foot in a funeral home or a funeral, right? I don't know about you, but our generation growing up, anyone who died, we were all taken to the funeral home. We were all taken to the funeral. My grandmother was
We
waked.
saw a dead body.
My grandmother was waked in our living room when my dad's mom died. I remember that. I was only about 3 or 4. That's probably my only memory of her, is her in her casket in our living room, right? Like, it was a part of life from day one. But now, like, we're such a death-defying culture. Nobody wants to talk about it. Nobody wants to look at it, right? Young people just, they don't know what to do when somebody close to them dies. They don't know what to do. They don't know what to say. They don't know how to process it. I've tried not to do that with my children. My children have been exposed to death, grandparent, great-grandparent, uncle. We haven't sheltered them from it because it's part of life. You have to know.
Sadly, in our phobia of death, I guess necrophobia, we ultimately cling to things that are dead, the material things, rather than the things that are true and beautiful and good, that are loving all around us. So we transition from a necrophobia. We've become a culture that is necrophilia, really, love of dead things, as we deny the life-giving aspects of dying and being around death as part of natural life. We cling to dead things. We cling to control rather than letting go to life-giving things.
Yeah.
Have you seen differences in, and this is perhaps not a palliative care question, but more of, let's say, a general nursing question. Have you seen differences in how people deal with or even recover from things like cancer and so on based on their spirituality? Like, I was reading an article in a magazine. It was talking about how, some doctors have observed that people who feel that their cancer was a punishment of some way, like, God has punished them with cancer, they recover much, I guess, much less, or perhaps much, it takes much longer than somebody who doesn't see it as a curse or as a punishment, but rather, as a suffering to be endured with the help of God. Do you see any kind of differences in how someone's spirituality can affect their recovery from a chronic illness?
I can think of 2 prime examples of 2 women in our parish who belong to a women's prayer group that I attend on every 2 weekly basis. Both women have just, in the last year or 2, have completed their treatments, and both of them have evangelized their physicians, prayed with other patients in the waiting room while they're waiting to receive their treatments, and both have done remarkably well. Right?
That's amazing.
Yeah. Yeah, and we don't have to look very far to see them.
So maybe, we can make a small transition here as we move toward being part of a worshiping community, being part of a church, our parish, rather than being seen as simply putting a heavy moral weight on people's shoulders, like, you shall not take maid. How do we as a community live this out? We as a parish community live this out so that we can offer better support to people who are confronting the reality of death and learning to journey with them. There's a real ministry opportunity,
Absolutely.
isn't it? Because there are so many people, if we talk about not wanting to be a burden and not wanting to suffer, I dare say we're in the midst of an epidemic of loneliness anyway. And so some people don't want to be alone anymore, like that 92-year-old woman.
Yeah, it's true. And I think there is a real opportunity for ministry there. I don't know how do we find out who's there and what they need and set up a support system to be able to give them, what they want.
Yeah.
Well, and the beauty that I found in your story, where you're talking about the two ladies from the parish, is that they were carrying a tremendous burden of their own illness, right? Their own suffering, their own worries about what was going to happen to them. But despite that, they were reaching out to others around them to say, here's the consolation that I have, through my faith. I want you to share that same consolation too. So when folks say, I'm too busy to evangelize, or, I'm too busy to get involved. Here are two people who had every excuse not to be evangelists, not to be involved, and yet their faith impelled them to do that. I think that's just beautiful.
Mm-hmm.
It is indeed.
So perhaps this is something to think about for parish. I'm not.
Think I haven't thought about this.
Yeah. Well, is it okay if I suggest, if this resonates with someone who's listening? How do we build a ministry? How do we build a parish team so that people can contact us, so that we can begin the process as your colleagues? How many nurses did you say are in the community? 12?
There's 10 to 12 in all of HRM.
So that as they are doing their beautiful work of helping with the palliative care process, then perhaps, and separately, for people who desire it, we could form teams that come alongside people in our parish who need spiritual care through this. I know I would love to be involved in this type of work. Yeah.
Yeah, there's definitely a need, that's for sure. And what it looks like or how we manifest that, I don't know, but I think, I'm interested.
So if you have ideas as you're listening out there, if this is something that you're interested in being part of, or interested in becoming part of a conversation of what it could possibly be, please reach out to us. We'd love to talk to you about it.
And it is simple companionship. Like it can begin with just that, like I'm sure there are many people who are within, the hospital system, within palliative care, hospices, etc. They just they're not looking for answers necessarily. They're just looking for someone to talk to, someone to, talk about the process, as you're mentioning, Rob, with that lady who you're visiting. It's like, I don't know how to do this. It's like, it's like you'd say, well, I don't know how to do it either, but here's how my faith will give you, some hope, some consolation, some encouragement for the journey that, that you're going on. And, I think people who are talking about this ministry that you're proposing, like, again, don't worry about having the right words. Like, just be there with the person and just listen to them and listen to their stories about what they're afraid of, what they're, what they don't know, what they do know. And, just from your own faith experience, offer up whatever consolation and accompaniment you can.
Accompaniment. Absolutely. Yeah. Empathetic accompaniment, faith-filled accompaniment.
Lots of times patients feel like they can't talk to their families about things like this, right? I'm not going to tell my kids about this, or I can't talk to them about it because they get upset, or, whatever. And sometimes it helps just to have somebody who's not involved.
Isn't that really interesting that we're so focused on not upsetting our kids. We won't talk about something which, you're talking to the person who you've known them the longest, right? You've known the most, but yet people are afraid to talk about something with their family that they'll happily talk about with a stranger. Yeah. And I find that as really fascinating. And I wonder why do we put up these emotional walls within our families, that make us say, well, I don't want to talk about it with my kids because you're like you said, I don't want to talk about them with my kids because it'll make them upset.
Yeah. And these are adult kids we're talking about.
Well,
These
exactly.
aren't little kids. Or
Right, so
yeah.
And even little kids, it's fine to talk to these things about. I anointed someone in another senior's home a few weeks ago, and they brought their the only grandchild of this dying person there, and it was beautiful because this grandchild had been with grandma throughout the process of infirmity and regular visits, and it is a healthy and good thing to expose our loved ones to, of all ages.
Mm-hmm. I agree.
Coming back to general surgery, you were talking about how death is considered a failure. Do people consider their own death a failure?
I guess it depends on where they're at, right? In the scheme of their life, in their faith, in their journey. Yeah, that's a good question. I don't have the answer to that one.
I was just wondering, like, if you've seen people that have, like some people I'm sure are at peace with their death, for whatever reason. Other people are angry. They're angry. Why am I dying? And other people are like, woe is me. I shouldn't be the one dying. Do people kind of say, I must have done something wrong to be dying?
I haven't experienced that so much. I've seen a lot of the anger, but a lot of that is just needs time to work through. I'm reminded of a nurse that I worked with, I think we're almost the same age, who died on our unit of breast cancer a few years ago, and she never got past the being angry, being past the denial of she was going to die. So sometimes people just don't get there, no matter how hard you try. But our palliative care team works really hard with patients to get them to the point of saying, okay, I've done what I can do and I'm ready to accept what's coming, and, let's do this journey. So
I'm sure even when the P word is mentioned, shall we say, like that must be the first threshold that you're like, okay, you're telling me I need to go to palliative care. Clearly, I'm going out now.
You know something I don't know.
Exactly.
When we walk into the patient's
I've,
room and say, we're from palliative care, did you know we were coming?
Yeah, it's like, so now you're on the down escalator, and you're here. This escalator is not going to turn back up again.
Yeah. And so many times patients have said, you know what, you need to change the name of your team. Well, you can change it to something else, but then it's going to be the same thing. Then you're going to be whatever you change it to, you're still going to be known as it's the dying team or the symptom team, or doesn't matter.
Yeah.
Can I ask a complicated question?
Okay.
What is it like when somebody dies?
It's beautiful. I've been at so many incredible deaths. They can be very, very peaceful. Lots of times patients will wake up shortly before they die and will reach out to someone or something, or reach up, or will kind of stare off in the distance. Sometimes they'll see family members that have gone before them. Sometimes it's a little more of a struggle. People struggle to get to the end with a little more difficulty with breathing or restlessness, but medications are very helpful for that. I think it's always more difficult on the family that surround the patient than it is for the patient themselves. It's a privilege to be present. I can't tell you. I kind of think sometimes I wish I had kept track, but maybe I don't know. But I'd like to think that someday I'm going to meet all those people again, and they might say, hey, I remember you. You were like the last nurse that I saw before I left this world. And it's funny, Tim and I did the parking in the parking lot on Easter Sunday morning, and there was two ladies came by that don't go to our parish, and I recognized one of them. And so I just stopped to chat with her, and I used to work with her daughter, but I also was her husband's palliative care nurse. And she said to me, you were there when he died. You said the Hail Mary. I don't remember that part. I remember being there. I remember caring for him, but obviously that stuck with her. That was what happened when he died. So yeah.
That image or that description you had there of people seeing loved ones, like that's really amazing. At the time in which this person is dying is in essence leaving their mortal body. They're being accompanied.
There's somebody there.
They're seeing somebody there who's like, come home, like come with me. I'll take you the rest of the way.
Mm-hmm.
Like that. I mean, it's quite awe-inspiring.
And it's comforting, right?
Yes.
To know that there's somebody there waiting to help you across, right?
But then you also mentioned the other people who seem to be fighting. Like they're fighting to stay alive. They're fighting, this process that's coming over them. Like you said, they're restless. They're, perhaps they're moaning or they have the death rattle, I think they call it, and their breathing's becoming more labored, and they're obviously in distress, and so like what's that experience of fighting against death, as compared to people who are accepting death as the next step to be with the loved ones that they're seeing,
I just remembered a younger lady that I had. She may have been like maybe 30, 35, and she was very obviously dying. Her husband was with her and her sister, I want to say, and her biggest concern was, what am I going to wear to meet Jesus? She wanted a new dress. She wanted almost like a wedding dress to wear when she died so that she would be dressed well enough to meet Jesus when she got to heaven.
Mm-hmm.
And when you talked about the 92-year-old lady, she was in this sterile room with no personal touches, nothing in there.
No people.
Exactly. She's basically being shelved, ready for death. And what a difference it would make, as you said, to be physically prepared, surrounded by your loved ones, being kind of reflecting back on your life, hopefully in a positive way, and saying, okay, I'm dying now. Here around me are the people I love. Here around me are the things which remind me of the good times in my life. I accept that. I take all that in, and I use that to fuel me for the next step. Like,
I think if you read the obituary this week of one of our parishioners' dads, that's what his obituary said.
Yes.
Died surrounded by his wife and his children, praying for him.
That's beautiful.
Oh, praying. Yeah, absolutely.
Yeah, and I think, perhaps part of that preparation of the family, or, I guess the way in which the family deals with their loved one's death must have such an impact on that, The person you're talking about, they're surrounded by a family of faith, whose faith he instilled in them, and who, the faith that was preparing him for the next step of his journey, and he was kind of fueled and carried by the faith of his family around him, and like that is such an amazing blessing for somebody who's having, who's dying, to know that, my family is with me physically, but they also are with me in prayer as I offer myself up as a prayer to God in my death.
Thank you, Monica, very much.
you.
It's been another lovely conversation.
Was it what you expected?
Sure. I wasn't quite sure what to expect. No, this was good. This was very good. Lots of people don't like to sit around and talk about death.
It's so sad, though, isn't it?
It is.
Because for me, it's life-giving to talk about death. Yeah, to go there, because it is part of...
We're all going to go there.
We're all going to go there. It's part of life. Yeah.
How do we get people more comfortable with death? I think. Like, how do we as a parish, get people ready for that conversation and to kind of remove some of that fear, like around death and dealing with their dying loved ones?
It's a great question. I hope we can wrestle with that as a parish, because it's really, really important, and we need to get better at it. Because even, I dare say, most people of faith, sadly, aren't comfortable sitting around having a conversation like this about death and dying.
And I think building on what you were saying, Monica, like folks out there who are listening to this podcast now, have a conversation with your family about your death. Like have a conversation about how you want to die, or how you want to be accompanied and supported and aided, at the time of your death. Like, have that conversation now, before it gets to the point where you are in palliative care. And like, honestly, the experience we had on Sunday when you brought John up, and John was, it's like you said to everybody, like, this man is in palliative care. John is dying. And, a hush, like everybody in the church.
Because everybody knows it, but nobody wants to say it out loud. Well,
exactly. Nobody wanted to talk about it. But, there was this collective gasp, right? It's like, you said the D word, right? John is dying. John is right here. And John is dying. And people need, I think, to get that presence of people who are dying, to realize that, as you said, Monica, it's part of life. It's part of everything we will all go through. And when we're not, we'll always be afraid, but when we are more prepared about our death, when we approach death, from the grounding of our faith, from our belief, in God, and being able to have that faith journey with a community of faith, with a family of faith, like, that is just, it's life-changing.
And it's life-changing for everyone who journeys with that person. John's case in point. John doesn't want to die. He would rather live longer. But that's not his choice to make now. And he's accepted that through a beautiful process of coming to accept it. And it has been inspirational to journey with him. And he's touched many, many people around the parish because he's open about it and he's talking about it. Yeah.
So I think that was just a profoundly beautiful moment.
And he wanted to be at the Easter Mass. He wanted to be with his community of faith and to share a gift that God has given him, which is a musical gift. He wanted to play the trumpet for Easter Mass in the midst of his community of faith gathered around the altar to say, "Thank you, Lord, for everything you have given us." It's beautiful.
And like the people, Monica, that you mentioned, that during their treatment were ministering to others. John in the midst of his death is ministering to others.
He ministered to many more on Sunday than he even knows. Absolutely.
Again, how can any of us say, I'm too busy to minister to others, when you have people who are actively dying, who are still ministering to others? It's just beautiful.
So, Monica, before we end this conversation, I'd like to draw to everyone's attention that Monica will be speaking along with Deacon Larry Worthen. Deacon Larry is with the CMDS, the Christian Medical and Dental Society, about medical assistance in dying and a Catholic response. That will be taking place on April the 25th at 7 p.m. Thanks, Monica.
Thank
What
you.
a pleasure.
Simon, thank you.
Yeah, and I want to thank everyone who's listening to the podcast. As we mentioned, we encourage you to talk about dying. Let's not be afraid of the D word. Let's have that conversation and have it openly. Talk about your fears, talk about your hopes, but have that conversation. I think it's so healthy for us and for your family, so that they know how you want to be accompanied during that time.
And don't be afraid to reach out to the parish if you're interested in being part of a ministry that accompanies people who are in the dying process.
So we do thank everyone for listening. We encourage everyone to leave a comment. We love getting your feedback. And make sure that you like and subscribe so that you get more great content from Father Rob's channel. And click that notification bell so you know when our next podcast is coming out. And as Father Rob mentioned, we have Monica's talk coming up at the end of April, but there's tons of other activities going on at Stella Maris Parish. So please find us on Facebook. Stella Maris is on Facebook, and also our website, stellamaris.halifax.com. Please reach out. We love to hear from you.
Monica, the image of you praying the Hail Mary with that dear woman who you mentioned. You want to sign us off by just praying a Hail Mary?
Absolutely. Hail Mary, full of grace, the Lord is with thee. Blessed art thou among women, and blessed is the fruit of thy womb, Jesus. Holy Mary, Mother of God, pray for us sinners, now and at the hour of our death. Amen.
Amen.
Amen. In the name of the Father, the Son, and the Holy Spirit.